I'm Joe Chille. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Dr. Kaplansky. Doctor, I look at some of the certifications here. I look after your name and it looks like the alphabet, you know, with all the different things. Sure. But board certified in implant dentistry, diplomat of the American Board of Oral Implantology. What is it to be a diplomat? What does that exactly mean?
It was a lot of hard work, Joe, so to get to that point. Yes, absolutely. So to become a diplomat of the board, you have to not only perform thousands of implant surgeries, you have to take countless hours of continuing education, you have to pass a rigorous 3-hour written test, and you have to present 7 cases, I believe, your 7 surgeries to the board and defend them in front of people. So it's an oral exam that you have to take.
It's a little bit too much of an examination, I think, for me, but and I'm sure all of these things are costly as well. It's something that you have to prepare for.
I will tell you the most cost is the cost of what we would call being away from the family, being away from the office. That's where the most, because you have to attend these meetings, you have to go to classes, you have to travel a lot. But I have absolutely no regret. It was a fantastic process, and it gives you a sense of accomplishment that nothing else would.
And you have another family member that is probably going to go into dentistry, right, in school right now.
My son is a D3 in dental school in Buffalo, and I'm very proud of him.
Yeah, and that's something to be proud of, because not everybody wants to go into the family profession, if you will. You know, Doctor, there's so many different things and different firms and different kinds of individuals that are talking about dentistry, and national firms too. You know, when you see for me, when I see something come in like a national firm, I think of it in terms of, like, Buffalo is known for its hole-in-the-wall restaurants, right. The small restaurants that make it unique, you know what I mean? Right. Not the big national firms, you know, you can get those anywhere. And I kind of think it must be the same way with dentistry.
It's a great comparison. So the movement in dentistry is consolidation, so a lot of offices are very corporate right now. We have remained privately owned. It's my private business, and we are very proud of it. And it separates us from the rest because the quality of the work is higher, the attention to detail is better, and patients in general are happier because they see the same provider every time they come. They bond to us, we have a relationship with them, and they feel like family when they come in.
How many implant surgeries do you think you've done?
We do on average about between 800 and 1,000 implants every year.
Really?
Yes. 800
and 1,000. And these individuals come back to you so that you can check to make sure everything is going well?
Yes, we encourage patients to do that every 4 to 6 months. Absolutely.
What, to the average viewer right now, that is dealing with dentures or has dealt with dentures in the past, that has broken teeth, that have had an accident, that have gum disease or whatever it might be, what's their first step?
Very easy, just pick up the phone or send us an email from our website. And the first step usually is a consultation. They come in and they talk to our implant coordinator. We do either a 3D scan, that's a CAT scan, at no charge to the patient, or we take a panoramic x-ray, again at no charge to the patient. And they get to sit down and talk with implant coordinator and me. Sometimes that consultation lasts for an hour or longer. And we spend all the time with them to pretty much explain all their options, go over what the process would be to do the treatment, and they leave with a very good knowledge and understanding of what to expect. But that's their first step, right? And then usually after the initial consultation, we schedule what's called a records appointment. That's when they come in and we take photographs, we take digital scans of their mouth, of their face. All that gets digitized in the computer, and then we use that to build up their digital sort of a case virtually, and then that goes into surgery.
And this is an evolving process that you're doing, right? The Teeth Now process isn't just something that's stoic, it's fluid, right?
No, absolutely. So the Teeth Now process means that they get their permanent, meaning non-removable teeth within 24 hours of a surgery. Then they go through the healing, and then they get their final or permanent appliance, usually about 5 months after the initial procedure. But they have fixed teeth throughout the entire time. So the process is evolving. There's constantly updates on digital technology out there, and we are right at the cutting edge of all new and digital technologies out there. So we incorporate them into our process constantly.
The other thing I have to say that is very impressive to me, not only all the certifications that you have, but when I look you up online, to see the positive testimonials from people, even down to the fact of saying that you're very affable, you're very nice, you're a great guy. I mean, when they talk about these things, it's more than just what you do professionally, it's how you treat them personally.
Thank you, Joe. It's really humbling to see how many of our patients say good things about us, and we work hard. It's not just me, it's the entire office, my entire team. So all my assistants and hygienists and office staff, we all work towards the same goal, and it is to make patients happy.
And if people are told they're not a candidate for implants, you can tell them maybe differently that they may still be a candidate, correct?
Absolutely. So there's still a small percentage that may not qualify, but most of the time we say, yes, you are a candidate.
Well, that's great. I mean, I think to me, it sounds like it's a simplified process. It is something, when I hear implants, kind of scares me a little bit, but your process seems to be something that I would be agreeable to. So I think that it's something that you've done very well, and I compliment you on that.
Thank you, sir. I appreciate it.
For more information and answers to your questions, contact Dentistry by Dr. Kaplansky by calling 716-772-7500 or go to drkaplansky.com. Promotional and sponsorship consideration provided by the following.